Thick Descriptions disrupts traditional educational methods. And why do we do that? Because we want to help humans thrive where they are, building better communities. One way that we do that is the Elephant in the Room Unboxed, where we give our audience members the tools and the resources to have those uncomfortable conversations and do it in a humane and anthropological way. We're doing this in partnership with Respect Diversity, another organization that is committed to doing the work with us. Each episode will have a different host and a different guest talking about uncomfortable conversations or uncomfortable topics and giving you the resources of how to navigate them. Let's get uncomfortable.
With this word. So before we get into that, what did you want to be when you were little?
I always wanted to be a doctor of some sort.
Okay.
I was really interested in women's health at a young age. I used to be a candy striper at the hospital, but my path took a turn when I got the Gates Millennium Scholarship in high school.
Okay.
And so that scholarship gives you $250,000 up to for about 10 years to get a terminal degree, but it couldn't be a professional degree. And so from that, I got my master's in public health because I originally was in chemistry and physics. And honestly, there were not enough women in the field, and it wasn't really, people-centered. And so I was doing my master's program in public health, and I came across where birth rates were different for children born stateside than their immigrant mothers. And so I thought that was really interesting. Like, what about these children, maybe the second stateside, why was their birth rate lower than their siblings?
Got it.
And it was across the board. I cannot think of the particular study. It's an old one from the University of Chicago, but it was really drove me to understand genetics and think that there were some implications for genetics in chronic disease and health disparities. And so that's how I ended up in genetics and human genetics. And I just kind of spun all those likes together.
Got it. Nice. And just a side note, having some internet difficulties. So you've frozen a couple of times, and I know it's on our end, but just a heads up, if I ask you the same question again, it's for that reason. A reason that I wanted to interview you and talk to you. One, I don't know many melanated females that are geneticists. One. Yeah. Two, anthropology focuses on biology, culture, language, and history. And the plan for Thick Descriptions definitely in 2026, the latter part of 2025, is to lean more into educating folks as it relates to our biologies. It is the perspectives are numerous, from our bodies, the limited research as it relates to melanated humans in regards to a variety of different diseases. And the list goes on and on of why the research is there, but it's not as robust as for European American folks. A reason is the historical distrust and just the assumption that melanated human beings, our biology is similar, if not the same. And so the belief is, so we have this study on these women, mainly European American women. It would apply the same for African American, and it's not always the case. So you wanted to be a doctor. I could see literally when you smiled, when you said you were a candy striper, I could see you as a little kid being a candy striper. I really could. That is really sweet. Okay. And where was all of this happening?
I was born and raised in Arkansas, in Pine Bluff, Arkansas. And so I'm a graduate of the University of Arkansas at Pine Bluff. It's in a smaller HBCU in the SWAC. So that's the Southwestern Athletic Conference. And yeah, I grew up going to games on the weekends and ended up there for college and knew I was ready to leave. I was ready to get out of Arkansas.
You didn't want to stay in the Arkansas?
No, I did not want to stay in Arkansas. And so I went and got my master's in Arkansas as well. And then I went to DC and did a fellowship in Northwestern in Chicago. And so now I'm in Louisiana. Now
Wow.
I'm down south again.
Nice, nice. And so tell me about education. Like, was education really important in your immediate family?
You froze on my side. You said, what about education?
For your immediate family?
Yes,
Did we
absolutely.
lose you
My
again?
mom,
Okay.
education was extremely, extremely important. My mom was, she owned her own. Kids came through all the time. She just was really assured that it was the path to like greatness and success. And so we learned rote memory at early ages, discipline, using those, they used to be boards, right? And you have all your words on the boards and sight words. That's what they're called.
Yes,
Yes.
yes, yes. Yeah.
And my brother-in-law was a professor at UAPB when I was growing up. And so he helped me with all of my science fair projects and things like that. And when we got out to UAPB, we were in this program called HBCU Up. It was an NSF funded program, and STEM Academy was the name of it. And so we got treated like little professionals. We had a monthly stipend. We had monthly meetings. We had to take real world practice from our classes. We had to go to things like NSBE, which is the National Association for Black Engineers Conference. So we got introduced to like the career path of scientists and practitioners at an early age. And it really did help to shape me and figure out, my career goals.
Jen?
You?
Yeah, okay. Lost you for a few moments. So you said that your mom was big on sight words, and then I lost you.
Okay. I would say my mom was she owned her own daycare in Pine Bluff for over 25 years. And so
Okay.
she was really good about teaching students. We learned sight words. We had discipline. We, did the same things every day growing up at the same time. And when I was younger, my brother-in-law was a professor at UAPB. And so he would also help me with my science fair projects because he was a physicist, but he's more of an industrial engineer, but he majored in physics too. And so that's where I got my knowledge of like, oh, this is what you do for a science fair project. And it just became interesting to me. So that's how I kept up with it.
Got it. So where do you think the love of connecting higher education with the public, where do you think that came from? And more so the knowledge that you and most people in higher ed obtain.
Yeah. So I would say when I was in graduate school, one of my advisors was really community focused. She would make us go have community talks. We would invite the community to symposiums. We had to do some community engagement practices and exercises. And you would learn that people, they're not ignorant. Okay.
Correct.
Two, they want to know, and some of them do know a lot, but you also have to learn how like scientific communication for different audiences. And it just became evident to me like, oh, this is a part of the gap and the barrier in science in terms of, why we don't see a lot of African descended communities and Asian communities in genetic testing, why we might not have good rates of like actually going to the doctor, things like that. So it became an understanding that it's not really the material, it's how the material is presented. Are we having conversations with these communities? Are we disseminating our findings back to the community? Are we thinking of them in our budget? Just an array of things that I have learned over the last 7 years as it pertains to being community centered, involving them in steps of research, and just keeping them active and engaged, because I think that's the largest part that we don't often talk about.
Right. So tell our audience a little bit about some of the projects you're working on now and how that connects to what you just said.
Yeah, so I am the director of the Public Health Genomics and Health Equity Lab. Now we're Public Health Genomics Lab at Pennington Biomedical. And our projects are focused on community genetic testing as well as genetics education. And so one project that we just completed was called the Genesis AI project. And we took the community participants, people, scientists, physicians, museum curators, for one, linguists, like people that just really know the African descended populations here in Louisiana, and we asked them to participate in interviewing. So we wanted to make modules, and I kind of talk about it like a course meets documentary. And so we took all those peoples and we made a documentary for 5 episodes, right? And we wanted the community participants to evaluate the education that they learned within those episodes. And so our target goal was to create this, or co-create really, this digital education genetics platform. And so the participants, we had over 43 people to complete all 5 weeks of the study and give their feedback in focus groups. We also had over 200 people say that they were interested, and we only recruited for about 3.5 weeks for this study.
Oh, wow.
Right.
Nice.
Yeah. It was fully remote, and that we didn't have anybody come to the center. You could do this from home as long as you had Zoom. So I wanted to introduce the lab to the community as well, but also get them to participate and also make it easy with their schedule. So this was like almost like an asynchronous class, if you will. They got to do it when they wanted, and give us feedback. And so now we have feedback on how to tailor the platform for the community needs at large. And I thought that was really important, because what I want to be able to do is if and when, or more so when I do have more studies in the community, I want people to say, hey, I can go to this platform and learn about what I can expect in terms of genetics education. Some of the episodes were tailored to Louisiana communities, so people can see themselves in the dialogue as well. And we also use museums because they are culture keepers. They have great records for ancestry and genetics. And we just really want people to understand it's not only an ancestral evaluation, but it's also a health evaluation.
Right.
And so getting people to take that with them and go back to their doctors and have some of those conversations that they need to have, or talk to their family members. So that was the first project, Genesis AI. We have a second project coming up this summer, and it's called Linking Gains for short. But it's about looking at the effect of knowing or knowledge of genetic risk on participant health behavior. And so we're going to take about 50 to 60 participants living in North Baton Rouge. They need to be of African descent. Now, we prefer if they live, work, or play in North Baton Rouge. Just because that's the way the grant was written. But if you live in Ascension Parish, Louisiana, or the surrounding metro area, we're not going to take you away. It's just more so about coming to the interventions for 16 weeks. That's quite a time commitment. And so in this study, we'll take about 50 to 60 participants. They will be randomized into 2 groups, and one group will get their genetic testing results in genetic counseling session prior to the intervention. The second group will get theirs at the end, or the last 2 weeks of the intervention. And what we want to see is, does the group that gets their genetic results, do they stick with the 16-week intervention more than the group that does not get their results? We're wondering like what the impact is knowledge of genetic testing results. Does it scare you? Does it keep you in a program? Does it not matter? Is there no relationship at all? And so that's how we're going to compare the 2 groups. And for 16 weeks, the community will get like food from fresh produce from farmers, dietitian, nutrition, physical training activities. They'll get to meet and have some talks with physicians if needed. And we just want to kind of get them going, learning about like conscious eating and how to prepare meals, maybe in a healthier fashion that we enjoy in the African diaspora. And so that's what that project is about. And we also have some genetic testing opportunities for people who cannot and do not want to participate in the intervention. They can get the same genetic test with a free counseling session as well.
Nice. Do, yes, I would definitely want to delve into that. However, before delving into that a little bit more, you and I, during our last conversation, you talked about viewing, because there's a big push right now amongst melanated humans of understanding our ancestry, having more information about our ancestry. For most melanated humans, that information, be it from Africa and many other spaces, was lost. And for purposes of cultural identity, even language and archaeological understandings, it's definitely important. However, my conversation with you, and you really positioned it as being a health issue, a biological understanding of ourselves. Can you delve in a little bit more into that?
Yeah. So there are plenty of genetic tests. The test you take with me might not be the same that your doctor will give you. Just because you take a test that your doctor gives you, it might also be looking at a specific set of symptoms. And so it's important to remember that you should test early, often, and all throughout, I would say, as many tests as you can ask for or that you want to take. And so that's one thing that you can do to understand your health profile. For one of our studies, we're using color genomics. Color is in alignment with some programs like All of Us, which is sponsored by the NIH, but they are a HIPAA compliant genetic testing site, which makes it really good. They won't be giving out your information. They'll also provide you with the ancestral analysis, some genetic testing, and then pharmacogenomics, which is a fancy word for how does your body deal with certain medicines. And so I think that is a really well-rounded test to start your journey. You can also look at ancestry.com. You know, they have the nice materials for you to go and dig more and look at your ancestry. And there's another product I'm starting to research called Self-Decode DNA. And they're a DNA company as well. If you use them, they will provide you with a health profile. They'll tell you about like what exercise tools may be more beneficial, what foods may be more beneficial to you, and that they keep track of things like that for you. So it is definitely something, genetic testing is definitely something that you should do, like I said, early and often, but also know that there are different types and that taking this information to your doctor would prove to be beneficial over time. I don't think people are cognizant that sometimes medical students only get about 5 to 6 weeks of genetic training. So it's one of those things you have to advocate for. If you feel like you have a medical history for it, if you are just wanting to take one, ask them what route could you go. So it's still an interesting time, I would say, for genetic testing because we have so many irons in the fire. I think we talked before about 23andMe now closing. And so there's a lot of maybe mistrust or, misinformation and understanding what it means for a genetics test. But I do think that in the future, it's still going to be very vital to get a genetics test and help understand your particular profile. What we didn't mention was that in addition to your ancestry and health, it also can help you understand how the environment around you is contributing to your overall health status.
And so you said a couple of things that I want to lean into. And so side note, Suzette, I'm talking to myself. Yes, definitely circle back with the different projects that you're working on. However, now I want to lead into using this information as to advocate for yourself and your loved ones. How can this resource, like the website or the testing that you referenced earlier?
Yeah, so with the websites that were mentioned, you're going to get a report back. They're going to tell you, what maybe what genes you have a higher risk for, or maybe how your environment, contributes. With color genomics in particular, they will do a genetic counseling session with you, and that's when you'll find out that information. So you can ask them like, hey, I know that this runs in my family. Why is it that I don't have an allele or a gene that is of higher risk here? And so that's one way, and why I would like to use color in future studies as well, because the counseling session is really important. When you go to a geneticist, you often get a report back, but nobody has really read to you what that report means.
Correct.
Yes. And so you can take those things to your doctor. Sometimes they'll have a genetic counselor on staff. You can also take them your family medical history, and that'll be a good starting point as well. Don't forget those cousins and those uncles. For certain things, they count as well. But mostly, we want to look at parents, grandparents, siblings first. We want to look at them first. And then we can ask the doctor to help us make plans for our future.
And so I love it that you are saying not only here's a resource that can give you information that you can take to your doctor. And so I know for me personally, love my doctor, absolutely amazing. However, every year when I do my annual, they ask me the same questions. Is cancer run in your family? Does this run? And lupus runs in my family. And so have been very diligent of making sure that that was something that did not impact me and stay on my offspring for it. However, that's, as you definitely identified, there's more that can happen to the human body outside of lupus and cancer. Though, I mean, the list goes on and on and on and on. And how would you know unless you ask? And so I know here, again, me personally here in Oklahoma, having to be an advocate for myself, because the assumption was, there are other women that have gone through this, so you should do this too. And it's like, let's think about this. Let's pause. Now, if this is an emergency, then yeah, I'll do this. But there's not an emergency. I don't want to be treated like cattle call. There's only one Suzette Chang, and just like there's only one Jen Caldwell. And although we say we share the same ethnicity, I am confident our biological structures are completely different. There are some similarities, but there's definitely some differences. And going deeper into our own genes, our own cells, to have a better understanding. And not only doing that, advocating for ourselves. Love it. And so with the websites that you referenced, is there a fee?
Yes, there's definitely a fee. I have not Googled them lately, so I don't know all of their fees. But color genomics is about $2.99 for the test, and including the genetic counseling. That's definitely a deal for all the things you get back. I know that Ancestry.com is about $30 a month for the subscription, but I think the test is around $99. Again, if you go to your doctor's office, you can ask them for a test, and that may or may not be covered depending on your insurance. But one thing that you kind of alluded to earlier when you were saying that you and I are biologically different, the same would be true if we had the same parents. If we had the same parents, we would still be biologically different.
Absolutely.
And so a lot of times,
even twins are biologically.
Sure.
Exactly.
Sure.
Exactly.
So just keeping that in mind, if your mom did the test or your uncle, that's still not you,
Correct. So, that is correct. And it's interesting you bring that up, because in the presentations I do throughout the state and just around the world, the first thing I say is diversity starts with our handprint. That's true diversity. Because no human being has the same handprint. So if you don't have the same handprint, guess what else we don't all have the same of?
Yep.
Similarities.
Yep. Very different.
Similarities, but not the same.
Right.
And so this need to have a better understanding of our own biology, specifically for communities that have been historically overlooked, I think it's powerful. And yeah, I get it that the $300 might be a bit of a stress for some people, but ask if your insurance covers it.
Right.
See if your doctor is willing to recommend it. It may be covered by your insurance, or you may just want to pay for it out of pocket, but it's definitely worth it. So I want to role play with you for just a little bit, and definitely leaning into education. You definitely talked about how having a linguist is important for the different projects that you're working on. The belief and understanding is that they understand how different communities communicate. Um, I'll never forget, and I know I've said this before, growing up in the 70s and hearing the word funky and using it and saying that to my boomer mother, it was offensive because what it meant for her meant something different for me. That has not changed. Right. Not so much the word of funky, but just what words mean. And when you start shifting and moving into different communities that definitely can operate within standard of the United States, and then they have their own geographic spaces, the communication is often different. And so having that information, so let's say I do the gene test, have it, take it to my doctor, what would you recommend that I say to them?
So I'll use myself as an example. So I have some exposure of both of my maternal grandparents, as well as my maternal great aunts. Have all had some sort of cancer. Different types, different time points, but I knew that it was trending on that side of my family. So I went for my OB appointment, and I did my medical history at the beginning, and they just happened to have had a checkpoint that was like, hey, whoa, you have too many family members. You need to do a genetics test. And so after my wellness appointment, she directed me downstairs. That one was done by Myriad Genetics. It came back negative for what they were searching for. I want to make sure that's clear, because Myriad is quite probably different than another genetics test. And so I said, thank you. You know, they sent me downstairs. They took my blood. They sent it off. In about 4 weeks, I got my results. And so now we know that anything that I may be exposed to or have during my lifetime is more of an environmental influence. Now, we can talk about things like epigenetic, like if there's something that turns off over time. But again, that's more of environment. What we were looking at are these specific genes for a specific outcome. And so maybe not all the genes were captured. There's something else I could dig into, but they're going to go with what is the most probable in what they see most people with this trajectory of disease. What are their SNPs? And that just means single nucleotide polymorphism. Those are some of the little pockets that we look at when we're looking at genetics. So we want to look at those reads. So that's how I came across my genetics test at my doctor's office, just doing a simple family history.
Wow. And so you did a simple history, you talked to your doctor, and I mean, what language would you recommend for humans that are listening to this podcast and don't have the health biological knowledge that you have?
Yeah, for me, it was I was, like I said, start with your family history, family health history. I think it's a great place to start, because you can see if you have any trends, like is there diabetes by a certain age? Are there certain deaths? Do you see something in the family that came younger and in the youngest generation? Like, did the disease present itself in the 30s in the younger generation than the older? Those are some things you could do yourself, your own self. I think that is, you have to kind of start with that. pain point. And don't be afraid to switch doctors. Our doctor at that time, if you aren't getting the answers you think you should, definitely switch. But most doctors are going to look at that family health history with communicating our symptoms, because nobody's at home with us, right? And so I think women are we more commonly aspects of health.
Yeah.
So if you know, like you have a particular diet or what time of the day you're eating, if you know, like, hey, I eat a lot of rice, you know, those things the doctor needs to know as well, just as much as your family medical history. Also symptoms, like I think the best way to say it is, if you can't remember it, they're going to act like it's a minute detail, right? A minor detail. But if you can say, like, yeah, I notice I get these headaches around this. I notice I've had chest tightening. You know, I know that I have an arrhythmia. You know, the more in tune you are to yourself and the more you can present it and advocate, the more people will listen. And that sounds so horrible to say, right? Because you want people to listen when you say it quietly or softly. But I definitely think that you have to help yourself in that regard. What I will also say is, especially as it relates to insurance, I'm learning that they have to take this information as a script to the insurance company. And so you got to help them with their script. You got to help them with their script.
Agreed. Agreed. And well said. Yeah. I've had similar situations. So, had a fibroid from the time I was in my early 30s to mid 30s. And by the time transitioned from California to here, and when I arrived here, the first thing they wanted to do was give me a full hysterectomy. Well, right. So I want to just pause that for one moment, everyone. Do you hear what I said, and do you hear her response?
It was aggressive.
Exactly. 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 And the response was, well, you know, you're no longer in childbearing years. You know, I don't care if I'm no longer in childbearing years. Explain to me why you have to remove everything because of a couple of fibroids. Now, don't get me wrong, they were grapefruit size. It was a horrible experience.
Okay.
Very, very long story short, for over 5 years, I had to go back and forth with my then OBGYN and then consulted another one because the fibroids were in my cervix. They were not everywhere. And so at first, I finally got them and my insurance to agree to just try to remove it from my cervix. And they tried, was not successful. So then it was, okay, since they're growing, I'm having menstrual cycles that are insane. Okay, how about you just take the cervix out? And they were like, oh, we never thought of that. Right? Okay, listeners, watchers, are you seeing the look on the geneticist's face? Right? Right? It's like, and that's the type of advocacy, in my opinion, as a practicing anthropologist, that human beings, regardless of your cultural, ethnic experiences, you have to be willing to connect the dots when the medical profession does not. And no shade on the medical profession. I'm wrapping up a book right now called Good Genes, where the doctor is really leaning into how most doctors are trained, and they are trained to make money. Okay, I get it. Me personally, professionally, I don't mind you making money. I just don't want you to make it all on me and in this case, my body.
Okay. Get somebody else to do it. Okay.
That part. And so it's the stories that you and I have shared. Hopefully our audience will hear us, that you do have the right to not only ask questions, to provide information, to get as much information as you can, to share that information with your doctor, your OBGYN, whoever that human might be, And unless it's an emergency, sit down and just take some time to think about it. It may be uncomfortable, it may be, but when you look at the long run, because in my case, it was, so if you take everything out, then you are going to want to put a sleeve in me, right? No, it's not the sleeve. What was it called? Dang it, it'll come to me. But it was like a fishnet that they were putting in women. I don't know if they're doing it right now. I know there's been major lawsuits about this particular thing. And that was in my mind because although I don't have the training you do, being a practicing anthropologist, did have to do a lot of biology classes and so on and so forth, and understanding the relationship between culture and language and archaeology or our history and biology. It was also understanding that the human body is designed in a very powerful and unique way. And there are many organs, body parts that kind of lean and hang on each other or, spend time with each other. And when you remove something like that, and no shade against anyone who made that decision to have a hysterectomy, but when you remove certain, in this case, female body parts, there are other body parts that are kind of leaning on them, kind of sitting on them. Where are they? The mesh. That's what it was. The mesh. That's what it was. No. And receive pushback. Like I said, for years. Well, why don't you want to do it? It's so simple. For who?
Not take all of me out and be like, it's so simple. I bet removing your cervix was safer, more healthy, and cost less.
It was. And so now the big question is every year when I get a pap, well, now I don't get paps every year, pap smear every year because I don't have a cervix. So there's really no need. And my MD is kind of like, well, sure, what else you want me to check? I don't know. We'll figure this out. But I would rather try this route than to go that route.
And you have that freedom. You have to exercise it. You have it. The doctor's office is scary. People's blood pressures go up. In our documentary that we because they are less likely to tell the truth.
Okay. Say that again because we lost you again, Jen. You said in your documentary.
Yeah, in our documentary, we noted that talking about how they got more out of men, particularly men of.
Now I can hear you.
You hear me yet?
Okay, go ahead.
Okay. I was saying in our documentary, we had some sections in where physicians were talking about how men do better at their appointments when they have their wife, sister, or mother present because they're very detailed and ask a lot of questions.
Wow.
Yeah, where men just come in and say, first of all, they're going to say, everything's fine, a little bit here and there, but if you don't really tell them, on a scale of 1 to 10, hey, I'm telling you it's a 4, but I have a high tolerance for pain. Like you have to kind of get detailed and granular with yourself. So they'll,
That's right.
So they'll do the same for you. Because if you just say, well, it's all right, but it hurt, right? It hurts really bad. Then they're like, well, he said it was all right,
Right.
And that comes with, advocating for yourself.
Right. And that in itself is a whole conversation, is understanding the need and then the empowerment of advocacy, self-advocacy, and for your family and friends if you have the capacity to do so. And I love it that you brought that up. So men, if you are not comfortable going to the doctor, if you don't like it, if you're afraid of it, whatever the case may be, I know several comedians are in their 40s and 50s and talking about the cough test. And so they're making it funny so more men will go. And please take your wife, your significant other, your sister, your mother, any female that is going to use those investigation skills.
Yes.
Because it can help. It can definitely help. this is truly a journey of getting to know our bodies. As I was sharing, and I'm not sure if it'll come on the podcast or not, the things that I dealt with over 10 years ago, I'm not dealing with now, but I'm dealing with something different. I'm of the belief every 10 years for my body, something different comes about, and it's like, where did you come from?
Yep.
And it's not necessarily a bad thing. It's just telling me that my body has shifted. It has changed. It's doing something that is unfamiliar to me. And I get to take the time out to figure out, what does that look like and mean? Is there any health issues that are connected to this? Or it's just because my body is we're all getting older and our bodies just do what it does.
Yeah.
Wow. So leaning back, because we've got a few more minutes, I want to circle back to your projects. With the first one, what do you hope to learn from it?
Yeah, so we were digging through the data today, and that is the question that we have before we start our qualitative analysis process. Honestly, I think we have several roots in this study. So our overall thought was, how can we co-develop a digital education platform? And I think that has been successful in, we did focus groups. We have the output or the input that is from the community. So we have that. I think the bigger question is about the thematic analysis. We're going to be asking.
So what is a thematic analysis?
Thematic analysis, yes. So thematic analysis means themes that you gather from the interviews. And so in the community members' questions, we ask them about identity. How do you identify yourself? And then sometimes I'd ask the question and I say, okay, what's your ancestral identity? Because a lot of people would talk about what they did in terms of identity. Ancestral identity got more complicated. And most of our community members for the interviews were of African descent. We did have some others, and especially living in South Louisiana, who all is calling themselves Creole, who all are calling themselves by an indigenous tribal name or designation.
Right.
So we're going to see some interesting things on identity.
Mm-hmm.
We're going to see some information on Creole culture. And so we have some discussions about, our powwows the same as Zydeco's and Lala's? And so Zydeco's are done with Zydeco music. Lala's are a little bit more private. They're kind of similar to like trail rides. There's a lot of time where they happen here in Southwest Louisiana. And then powwow culture is a little different. It's a little bit more native. And so we have somebody that describes that. We have people that describe it differently. So that was something interesting. We have a lot of themes around trust in the medical community, what that looks like. We have actually a snippet of somebody who discusses her journey as an advocate, because she knew her body and she felt like her doctor wasn't listening to what she was saying. She got a new doctor. So I know that that's not what the digital platform was supposed to be about, some of those things, but that's definitely in the interviews. We talk more about the environment and how, people say, oh, diabetes runs in your family, but one of our guests was like, but that's because no one runs in your family. And so, right. And so we talk about, things that prohibit African descendants from going to the doctor, even the physicians, their take on genetics, like, do they see it as useful? And they're like, look, I'm just trying to get people to come back for their annual. You asking me a lot of questions about genetics. If it's not sickle cell or cancer, I'm not sending them, and it's not that they don't want to, it's, what can I get my patient population to do? What can we pay for? What can they pay for? And so you're learning about like things that aren't universal as well. You're just making me think through the data now, like just all the possibilities. And then we have the participant side where they're going to talk about how they saw the information. Like 25 minutes doesn't seem like a long time to some people. For some people, they want a short, they want to get a bite-sized piece. integrating infographics into the documentary so that people can see and understand for different um, learning ease. Let's see what else. Yeah, they're going to talk about what they would like to see and would they support this type of platform in the future. So those are some other themes about what would it take for people to support a health platform that they can customize for themselves. You know, would you support it? So those are some of the questions that we asked and some of the thematic analysis results we are hoping to pull out.
Nice, nice. And so, a reason that Jen and I connected, we have a mutual connection. And so, the plan for me through Thick Descriptions and through another platform is to really lean into the biological relationships between African Americans and Native Americans here in Oklahoma. Mm-hmm. And so, as I said, we have a mutual connection that is like, you two need to meet. And so when Jen and I started talking about, and when you brought up powwows and la-las, it's like, yeah, that's right. That's how we connected. Historically here in Oklahoma, the relationship between Native Americans and African Americans as it relates to African Americans being a part of Native American tribes has been very fractured, if not terminated, due to politics, the Dawes rolls, and a variety of other factors. And so there is a conscious shift happening here in Oklahoma, definitely over the last 20 years, but it is, you can actually see it happening where tribes are identifying ways for phenotypically African Americans to be part of their ancestor, part of their tribes. And a way to do that is through getting into themselves, all those wonderful trillions of cells that all of us human beings have, and figuring out not only our identity from a cultural perspective, but from a biological perspective. As you said earlier, I think it's ancestry.com and any other DNA platforms. I know for a while, because I have intentionally not been involved in that. Those particular platforms just kind of blew up. I remember when Dr. Gates got involved with it. I still remember the PBS commercial and all the stuff. And it was like, oh my gosh, this is getting ready to blow up.
Yep.
And so happy and grateful that that's happened. However, and for many, it's helped them to understand their ancestry as it relates to the continent of Africa. And wonderful. Glad that information was shared with you. And biologically, we've got to know what's going on inside of our bodies. Typically, our bodies will tell us, but if we're not listening, if we're not running, if we're consistently putting certain foods in our mouths, knowing that diabetes runs, I love that, runs and know you're not running. I love that. And culturally, and just within the context of diabetes, culturally that has become accepted, not just in the African American community, but America as a whole. You're a diabetic. Oh, here's some medicine for you to take to control the diabetes or manage it better. How about you rethink what you're putting in your mouth, or how frequently you're putting it in your mouth? Think Descriptions did a project in one of the historical Black towns a few years ago, right before the height of the pandemic. And that was one of the participants. That's what they said. We were dealing with health and biology. And he said, we are literally killing ourselves with the fork.
Yes, absolutely. Yeah. Absolutely.
Yes. So as we are wrapping this up, because I know we talked about one project and what you hope, what do you hope with the other project?
Yeah, so the other project has been my baby for a while now. We have been fighting tooth and nail to get it started. And so we're going to start recruitment next week.
Congrats.
Yes, finally. So I'm hoping to see diverse populations, my peoples. Okay, I'm hoping to see them excited about genetic testing, for one, or even if they're leery, I just want them to participate with this company because you get the genetic counseling session. So I'm excited about that.
For free.
For free. For free.
Yeah.
We provide all that for you. You just have to enroll and stick with the program. I'm also interested to see how people respond to the interventions with all of the barriers stripped. So what I mean by barrier stripped is this project will take fully weekly in North Baton Rouge. So North Baton Rouge is where Southern University is. And so just to give you a quick background, we wrote this for Scotlandville, which is also called North Baton Rouge. Okay. But I'm on the LSU side. So LSU side, the southern side of Baton Rouge, the students have grocery stores on LSU campus. But where Southern University is, there's no grocery store in the whole congressional district. Right. So I'm excited to bring a program there that provides food, that provides resources that are outside the medical district. I'm excited to work with the community. All of our interventionists will come from the community at large, so people can go back to them after the study is over, right? Nice. I'm excited.
Is that an anthropological part?
You like to see? Very, very small touches, but they get in there. Yes. That district is also historically browner and blacker. They have high crime rates, and we're starting the intervention after 5:30 because another barrier is people don't want to skip to go to work. And asking for somebody to come somewhere for 16 weeks is quite a long time.
Agreed.
And we get there pretty good with larger grants because we're able to give you more money. If we can give you $300, for 2 weeks, we can do that. But that's still different when you want immediate things like food on your table, paying your bills. And so we're starting at 5:30 in the community. It'll be at Jewel Newman, which is in North Baton Rouge, and also Greater Allen, which is a church on Scenic. So these will be places that people are familiar with after 5:30, free things, free. We just want you to participate in about an hour and a half of your time each week. That's it.
And adults, so 18 and over.
18 and up. Yep, 18 and up can participate.
Okay. And so, folks, if you are in the geographic area and are interested, please participate in this. This information is needed. It is needed.
Very much so.
And we've got just a couple more minutes. And the last project?
Oh, the last project is a continuation of the project in North Baton Rouge, but it will consist of people living throughout Louisiana. So we want them to live throughout Louisiana. They'll get the genetic test and the genetic counseling for free. And they just need to do a couple of demographic surveys. They'll get paid. They get paid for all of my studies.
Nice.
Yeah, they get paid. And
incentivizing people is definitely
it's important.
Yes.
Yeah, they get paid for all of them, but we want to make sure that we do things that are remote or mobile, just because Pennington is located in the southwestern part of the state. And so, but if we want to get more people involved in the northern parts, Natchitoches, Cane River area, Monroe, Shreveport, Alexandria, we just have to make it accessible. And so we will make sure that they get their genetic test. They just have to say that they want to do it, and that's it.
Got it. Anything else you want to share as we are wrapping this up? I just want you to know I am geeking out in so many different ways. But yeah, anything else you want to share as we are wrapping this up?
This last year, I've been talking a lot about how we eat as a culture. So I'm learning all sorts of things from 9-ounce rules, which means like if you find a container that's about 9 ounces and you stuff it, that's about how much you should eat. I'm learning things about, what really should be on your plate, how you organize your plate, and what you eat first. So it has never dawned on me. Well, actually, they used to say all the time, eat your veggies first, because you want that protein and that fiber content. And then you move to your protein, your meats, and your carbs are last, so you don't get full on them. And I don't know if we think about that. I don't know if when we eat chicken wings and French fries, it cancels out because there's a lot of carbs going on. But I have enjoyed this year telling people that corn is a starch. Okay, it is not a side vegetable. It's not a vegetable.
That's right. No, ma'am.
So we're thinking
it
about,
frustrates me when I go to different
see?
restaurants and see on the menu vegetable. But you know what? Okay, go ahead.
No, I'm just saying. So, like when you were talking about earlier, how we are just, destroying our lives through a fork. It's what we eat, it's how frequent, it's the composition, and it's what you eat first. But I just think knowledge is power because we really don't know that. Like telling a person of color that a potato is also a starch and not a vegetable, those things are how you fighting. And it's like, y'all, listen.
And you want me not to have ranch on it too? You got
Yes.
to wait a minute.
Listen,
Wait a
if
minute.
you are a
I'm
saucy
not having
person,
potato with my ranch.
if you are a saucy person and you take sauces out for about a week, you will see drastic improvement in your vitals.
Exactly. Exactly. Exactly.
So it's a lot.
Exactly.
It's a lot that I'm learning.
I can remember a time where, because I can be a saucy person, sauce was my dessert.
Now, how you do that?
Because I can't, like, I'm not there anymore, but I used to love ketchup. Love, love, love ketchup. It went on everything, not like eggs or like French fries or whatever. And it was a big burger person. Then that means I'm not going to have apple pie or some type of dessert because most ketchup, and again, no shade on ketchup, it has a lot of sugar in it.
I see. Yes, it does.
So it's like finding that sweet spot.
You're right.
Where and truly telling myself, if you have this ketchup, this barbecue sauce, whatever, that lemon meringue pie, it's not going anywhere. It'll be there tomorrow or the next day, or that peach cobbler or whatever. It'll be there. It's not going anywhere. The sense of having it all, and you spoke about it, quantity, having it all now.
It's I think the biggest thing in our culture. We did some conversations with people who identified as food insecure. And, I was able to ask them, like, so what's up with the way that we buy food? And they were like, well, if this come in a package and I can freeze it, it lasts longer. If, fruits and vegetables, I'm spending just as much for them when it doesn't last as long. Popeyes is going to fill me up. So we have this identification in our brain that we need to be full and not satiated. It's so deep how food, what brown Black person gets together with no food? We will talk about it. We will talk about, I don't think you should do it. I'm not saying you should do it.
Right, bad.
But we don't even know how to do it.
Oh, I've used my own self as the tester and have spent time with other humans that look like us, especially women. And I will sit there and just drink water. Girl, what's wrong with you?
Yep.
Why are you not eating?
Yep.
Oh, you trying to tell me my food is nasty? No, I just don't want to eat. It's okay.
It's okay.
Yes. There's the cultural component of it.
Yes. We will fuss you down about that. I think we also fuss about like healthy weight is a different thing in African descendant communities as well.
I'm big boned, right?
Right. But your bones are the same size. Which everybody bones is bone density is a little thing, but I think the problem is overall that it's not. It's at least if we have the knowledge, right? That's my main thing. I've been getting fussed at about, well, are you going to pick a disease of interest? And I'm like, I'm less focused on a disease of outcome. I'm more focused on like, how do I use genetics, health, and behavioral education to like change the way we operate.
To educate people. That's right. That's right.
So that's been my interest.
Right. Cool. I know we need to wrap this up, but I just want to say this. It's more than a food pyramid, y'all. You remember, no shade on it. It served its purpose at that time. Now it's time to go a little deeper, have a better understanding of what we are feeding ourselves. Jen, thank you for your time.
Thank you so much. Really cool. It's been so fun.
Yes. So everyone in Louisiana, please check out Miss Dr. Jen Caldwell. And how can they find out more about it, like to participate and be involved?
Yeah, you can go to Pennington Biomedical Research Center. I can send you the information. But if you Google P as in peanut, B as in butter, R as in research, and C as in center, And then you Google my name, Jennifer Caldwell, the studies will pop up. We also have a clinical trials page where the study will be opened in a week on that page. And then you can email me at Jennifer, JENNIFER.Caldwell, CALDWELL at pbrc.edu. And I can direct you to the clinical trials page for those studies. We have a recruitment office too. So if you ever call and ask for my name or the studies that I'm launching, then they will point you in the right direction as well.
And do you know that the office number for those that are phone humans?
I don't. Let me see. I can find this real
Okay,
quick.
please and thank you. I try really hard to shift and move to how people communicate because there's so many modes of communication from email to website. Girl, if I get another app, if it's one more person,
One more app. Okay.
I'm so done. I am app overload. Text, yeah. I get it. We have all these modes of communication and everyone's going to advocate for their own. What's the phone number?
It is 225-763-3000. That's 225-763-3000.
Wonderful. Thank you, Jen, for your time.
Thank you.